Ladies and gentlemen, without further ado, I'd like to bring you Dr. Bhavesh Doshi, Gastroenterologist of Gleneagles Hospital. Here he is.
Thank you very much, James. So my name is Dr. Doshi. So the topic of my presentation is on food, stress, and our gut, and when it's time to investigate. You've heard a little bit about me. My name is Bhavesh Doshi. I am a senior consultant gastroenterologist. I was the director of endoscopy at the National University Hospital, and my focus and my area of expertise is in both simple endoscopy, which is gastroscopy and colonoscopy, and also complex endoscopy. So this is a bit of a hybrid meeting. So I'm here in person, and obviously you're viewing this from your workplace. So I hope you enjoy the next 20 minutes or so. The focus of the talk is going to be discussing the gut-brain axis, the symptoms that arise because of stress and how stress affects the gut, the type of symptoms, the diagnosis, and our approach to it when you present to a doctor with these sort of symptoms, and how we investigate and manage these symptoms. So about 2,500 years ago, what some would argue as the father of modern medicine, Hippocrates, said that all diseases begin in the gut. And he is right. In fact, over the last few hundred years, we have more and more learned that our emotions, our stress affects our digestion. So this picture illustrates a fur trader about 200 years ago in Canada who was injured from a gunshot wound to the abdomen. He developed a hole in his abdomen, which was a chronic hole. So it was an opening into his stomach. So this was an excellent opportunity because he healed completely otherwise. It was an excellent opportunity for the doctors looking after him to examine his digestion, examine his intestinal tract in his day-to-day function. So they inserted a tube through the hole and they assessed how he digested his food during periods of stress, when he was happy, and when he was sad or upset. And what they found was that the digestion was never as good when the patient was stressed compared to when he was in a happy mood. So we know from several hundred years ago and even thousands of years ago that there is a significant communication between the brain and the gut. Now, it's not just a one-way communication. So it's not just the brain telling the gut what to do. It's actually a two-way communication. There's constant communication, both through the nervous system, but also through hormones and chemicals that are stimulated both by the brain and by the gut. This is obviously co-founded or contributed by other factors such as our diet. So if we have a diet which is very rich in processed foods and fast foods and things like that, that will add to our gut reaction to stress. So I think it's all a completely a huge cohort of factors which make a difference to our digestion. Additives in food, processed foods, alcohol has a huge impact on our gut function and our gut microbiota. Now, there are things we can do to improve our gut function, and this is having a healthy diet, less processed foods, more fresh fruit and vegetables, having breast milk during your childhood makes a difference to your gut microbiota, and obviously in adulthood, increasing foods that promote good bacteria in your gut. So there are prebiotics, which are nutrients for the microbiota in your gut, which are called probiotics. So there are several symptoms that can occur as a result of stress affecting the gut. The most common symptom that we see is gas and bloating. This is often related to chronic stress. So patients who have chronic stress in their life experience a change in the microbiota in their gut. And oftentimes they get gas-forming microbiota, which tends to produce too much gas, and as a result of which the patients have gas and bloating symptoms. So there's a clear link between the stress and the gut bacteria. They can often present with abdominal pain and cramps. Many of these patients may have symptoms of IBS. They may have hypersensitivity syndrome, whereby they may have acid reflux, both normal and abnormal amounts, but presenting with symptoms despite having normal amounts of acid reflux. So heartburn is not an uncommon feature for patients with stress. Some patients may present with constipation and diarrhea. Both of these can be consistent with stress-related symptoms, but as a doctor, we would often want to investigate further to ensure that there are no red flag symptoms and any significant pathology underlying. So this is a busy chart, and I'll take you through it. I want you to look at the left-hand side of the table where we look at acute stress. Now, acute stress is, if I give you an example of a scenario, if you're in the middle of a jungle and a tiger is chasing you, that's acute stress. Now, that has an effect on the gut. That situation stimulates immediate release of adrenaline in your body and brain impulses from the brain to the gut to stop you from going to the toilet or doing other daily functions so that you can escape that scenario and get to a place of safety. So that's a good thing. Acute stress on occasion is a good thing. It works on the gut to protect your body and to get you into a safe situation. But prolonged stress or chronic stress in studies have been shown to affect the microbiota in your gut, and in actual fact it increases the amount of unhealthy microbiota in your gut. So I think the relationship with stress is more to do with chronic stress rather than an acute event, an acute stressful event. So when we see a patient with symptoms, we need to decide, is this something which is functional, which we group as conditions such as irritable bowel syndrome, SIBO, which is small intestinal bacterial overgrowth. Now, this is a condition whereby you have too much bacteria that produces gas in the intestine. Or we describe it as functional, which is where we have almost hypersensitivity to normal responses within the gut. We have to distinguish between functional and organic. Organic is where there is organic pathology. There is a structural abnormality within the gut, within the stomach, within the colon, or within the small intestines, or any of the structures outside of that, but within the abdomen. So these include things like inflammation, ulcers, polyps, and sadly, we do see some cancers once in a while. So our job is to take a history to find out more about the symptoms from the patients. We may do some basic tests like blood test, we might do some stool test, and if we detect any red flag symptoms, which we'll talk about in a few slides down the line, we may do further detailed investigations. So one of the commonest things that we find is lactose intolerance. Now, in this part of the world, about 90% of our population is lactose intolerant. So it's not an all or nothing situation. It's, we all have some degree of enzymes that allows us to digest milk and milk-based products, but each one of us has a different amount. So we know over time we can work up what our natural amounts of lactose intake can be. So for myself, as an example, I can drink about 1 liter of milk without having any symptoms, but I know several patients who may be only able to tolerate between 1 and 2 tablespoons of milk. So everyone has a variable amount of lactose intolerance, but that's usually where we start. And we can do simple tests. We can actually recommend patients do a breath test to identify whether they have lactose intolerance. But oftentimes it's just getting a history from the patient and identifying that they're having too much lactose in their diet. The other thing we can do is SIBO testing. SIBO testing is where we do a breathing test for patients to identify whether they have too much bad bacteria in their intestines, which are breaking down food products that they're eating into gas. So this is a relatively simple test, but it's such a common condition that oftentimes just taking a good history from my patients, I'm able to identify that, and we're able to treat it without the need for additional tests. There is some increasing interest in gut health testing. So this is a very interesting concept. It's a work in progress. Essentially, we know that all of us have a slightly different microbiota profile. We know that some patients who have very bad gut symptoms may have a very abnormal gut profile, microbiota profile. And so this concept is designed to examine your stool sample and to be able to give you a complete workup of your normal healthy gut microbiota and to tell you whether you're missing some of these microbiota. And in fact, what this laboratory does is that they also produce probiotics which are tailored to your requirements. So not only do they work up whether you're deficient in a particular probiotic, but they actually can produce the probiotic for you to individualize your therapy. Red flag symptoms, I think red flag symptoms include things like blood in the stools, unexplained weight loss or unintentional weight loss, persistent symptoms, nighttime pain, pain that is not responding to medicines, and a strong family history of cancers. I think when a patient presents with these symptoms, we typically want to investigate further. We may do more invasive tests, and some of these tests include endoscopy, which is a gastroscopy, which is a scope to look inside the stomach, and a colonoscopy, which is to look at the large intestine. And we also do some imaging to have a look at the abdomen. So many people don't understand that actually when we're examining the abdomen or when we're trying to determine what is causing the symptom in the abdomen, we would broadly divide it between two main structures. We would divide it between hollow structures, such as the stomach and the colon, and solid structures in the abdomen, such as the liver, the gallbladder, the bile duct, the pancreas, spleen, kidneys. Each of these structures, the hollow structures, requires different types of tests, and the solid structures require different types of tests. Typically for the solid structures, like your liver, we can arrange an ultrasound, we can do a CT scan, or we can do an MRI scan. Each has their advantages and disadvantages. The ultrasound is very good for looking at the solid structures in your abdomen, but it can't see your whole pancreas. A CT scan is excellent for looking at the solid structures in your abdomen, and it can see your pancreas, but it does carry some radiation. An MRI is excellent because it can see all the solid structures in your abdomen, but it is an uncomfortable procedure sometimes, and people who are claustrophobic may not be comfortable going into a tunnel and lying there for 30 minutes or 45 minutes for a test. So each has their advantages and disadvantages. Now, why do we add on scopes to that if we're already doing a scan? Well, we're looking at a different structure. With the endoscopy or gastroscopy, we're looking inside the stomach and the duodenum. With the colonoscopy, we're looking at the large intestine. Now, there are specialized scopes that allow us to look at the intestines in between the colon and the stomach. These are called enteroscopies, and we generally, thankfully, don't need to do that frequently because it's an extremely long procedure, and it can involve an overnight stay in hospital post-procedure. Now, why do we do the endoscopies? Well, we do the endoscopies because we're looking for pathology within the stomach or the colon. So in the stomach, typically we're looking for ulcers or inflammation. We're looking for Helicobacter infection. Sometimes we do find polyps in the stomach also, and we should remove these polyps because we know that removing polyps reduces the chance of lesions growing and potentially becoming cancers. We have very strong data for the colon to say that if we did a colonoscopy on a patient who didn't have any symptoms and we found a colon polyp and removed it, that we can reduce the risk of cancer developing in that individual. So there is extremely strong data to promote the need for removing polyps during colonoscopy. So once we've done all the testing and we have identified that there isn't any serious pathology, then we can approach it in a very structured manner. We initially start with stress management. So we can do things like mindfulness exercises, cognitive brain therapy, yoga, just simple exercises, breathing exercises, those sort of things can help us cope with stress better. Usually that needs to be done in combination with either diet or medication. So if we're prescribing medicines, we prescribe medicines that reduce acidity in the stomach. We prescribe patients that medicines that actually reduce spasm in the intestines, and there are several probiotics which are shown to be beneficial in patients with stress-related IBS type symptoms. We sometimes talk to them about altering the diet. Now, I'm sure some of you have heard of a FODMAP diet. A FODMAP diet is essentially, a low FODMAP diet is essentially having foods that contain certain sugars that don't get broken down by the bacteria in the gut as much as other foods. So there are high FODMAPs and low FODMAP foods. The ones that we want to avoid are high FODMAP foods. So I'll just go through this table with you. I know it's a long table, but just as a general guide, there are certain fruits, apples, mangoes, tin fruits, that we want to reduce it. Not completely stop, but I would say reduce it, because they contain sugars that get broken down in the intestine into a lot of gas. Obviously milk-based products, beans and certain other vegetables are best to avoid because they produce a lot of gas. Now, I typically don't like to put patients on a long-term low FODMAP diet. I would try it for between 2 to 4 weeks, and then I would tell them to start to introduce these diets in their food. An alternative to the high FODMAP foods are this list of fruits and vegetables. And there are many sources of milk that are available nowadays which have low lactose or no lactose. There's also cheeses that you can try, which are hard cheeses. They generally contain lesser lactose. And in terms of fruit and vegetables also, there are multiple options that you can see. And I'm happy to share this list with anyone who's interested later. So I think in conclusion, we need to think of the effect of stress and the gut in a very wholesome manner. There are several factors that are involved in contributing our response to stress, particularly our GI response. There are some things that we can change. There are some things we can't. Our genetics we can't change. The mode of our delivery, the way that we were born, either through a normal delivery or cesarean section, has an effect on the gut microbiota. We can't change those things. But what we can change is the foods that we eat, our mindfulness and our stress, how we respond to stress, our social interaction with people around us helps us deal with stress better. The environment that we live in and the pollution that we come into contact with, the chemicals that we ingest, the supplements, the medicines that we take, and exercise. All of these have a major effect on our gut and our brain. And I think it's important to put it all together and not just focus on one step. Having good sleep, plenty of rehydration, avoid missing meals, managing your stress, taking a break from your work, even a 5-10 minute break from your work helps. And regular screening, I would say we would follow regular screening from the age of 45 or even younger in patients who are having severe symptoms. So if there's one point I would like you to take away from this, is that if you've been having persistent symptoms for more than a month, then I think it's important that you go and see a doctor and get it checked out. Thank you very much.